This is Kathleen Ayres. I'm going to point out the cranial bones. This is the frontal bone, parietal bone. Make sure you can see that. Yes, I think you can. Parietal bone, the occipital bone, and here at the base of the occipital bone is the occipital protuberance. You can't see it very well on here. This little, there it is, a little bump. And then that runs down to the occipital crest, and this is where the muscles and ligaments run that help hold up our head. This is the temporal bone. There we go, temporal bone. Continuing, I'd like to show you the temporomandibular joint. There we go, right here. You see that? Yeah, right here. The mastoid process, right here. The styloid process, which is right under here. See that? The external acoustic meatus. Here I put a little black dot in there so you could see that. And the squamous part, this temporal bone here. Inside we have the petrous part of the temporal bone right here. You see that? And the internal acoustic meatus, which is right here, and those house the apparatus for hearing and balance for the internal ear. Now I'd like to do the sphenoid on the external orbital view. You see? Orbital view. And here I put a dot on the greater wing. On the interior, the greater wing, the lesser wing, the optical canal right here, it's right up under here, comes through here, and the sella turcica, that is right here, and the fossa that houses the pituitary gland. The crista galli is this ridge right here that projects from the cribriform plate. This is where the brain attaches to the skull. The cribriform plate, which is right around here, and the little holes, the olfactory nerves pass through those to the brain. Go over my sutures. My skull back on. The coronal suture here in the front, or the crown. You see that? Yes. And the sagittal suture, which is right down the middle. The lambdoid sutures here, across the back with the occipital. And the squamous, which is right here. The squamous. I'm going to do our facial bones. The maxilla, it's an area here with the alveolar process, which is right across the top of the teeth here where the teeth go in. Our nasal, right up here, it's light, right? There we go. Nasal bone, zygomatic arch, which is here. The two bones that make up the zygomatic are the zygomatic process of the temporal bone and the temporal process of the zygomatic bone. The zygomatic, that's our cheekbone. Okay, I have the ethmoid bone here and the vomer right here. The nasal concha, it's inside here. And now the mandible, let me just take it by itself. The body of the mandible, the angle of the mandible here, the ramus, which is right here, just draw that on, the mandibular condyle, which would be this piece here, the mandibular notch, whoop-de-doo, right here, the mandibular notch, and the coronoid process, which is this inner point on the mandibular. I'm going to talk about the vertebrae now. The vertebral column is made up of the cervical curvature, the thoracic curvature, the lumbar curvature, and the sacral curvature. The two primary are the thoracic and the sacral, and the two secondary are the cervical and the lumbar. The cervical vertebrae, there are 7 vertebrae from here. Can you see that? There. From the top here to here, the first 7. They have the atlas, has articulate facets on both superior and inferior surface. On the superior, it receives the occipital condyles of the skull, which allow us to do this, nod our head. The unique thing about the transverse process of all the cervical vertebrae are that they contain a transverse foramen. The thoracic vertebrae, there are 12 from here, oopsie, to here. I'm going to point out the spinous processes, which is this. Let me see if you can see what I'm looking at. I wish I could get it closer. This back spiny piece, right here, right there. The transverse process, which is the side here that sticks out. The invertebral foramen, you can see those. Yeah, you can see those right here, these holes that go in between. My fingers out of the way. And the spinal nerves pass through those foramina. The body of the centrum, this way, it's right here. And the position of the intervertebral discs, and that's this little in between. I'm drawing on it so you can see it's darker. There it is. right there. Let me turn Guy back around here. Oops. The lumbar vertebrae, there are 5, it's right here. The sacrum, right here, which is 5 fused bones. And then the coccyx, this tiny little right here. I'm going to turn to the sternum. Get out of the light. Manubrium of the sternum is this little flat piece here at the top. The body of the sternum is here. The xiphoid process is this little thing at the bottom here. And the jugular notch is right in between the body and the xiphoid process. It's right where that little thing here, where the little screw is. The vertebrae, I'm going to point out the true ribs, the vertebrosternal true ribs, and the false ribs. Get a better angle here. These first 7 are the true ribs. These last 4 are the false ribs. And we have our floating ribs, which are these 2 in the back that you can see. Right, these 4 right here. Okay, I'm going to point out the head, neck, and tubercle of a rib. Okay. Turn around here. Here's the head of a rib here. The neck is right in here. And the tubercle, let's see, it's a little notch at the spine. They don't have one that looks... Well, it's a small notch on the rib at the spine. So let's just say, for argument's sake, that my model has a little notch right here at the spine. The ribs articulate with the vertebrate body by 2 facets. One joins the body of the same numbered thoracic vertebrae, and the other articulates with the body of the vertebrate immediately superior. Oh, it looks like that will conclude my video. I hope you could see everything that I pointed out. I'm going to splice this together and turn it in.